So I just saw a patient with PCOS. She met all three criteria: Rotterdam criteria. She had irregular periods, so her periods were not coming every month. In fact, she hadn't had a period for 4 months. She had elevated testosterone on her blood work, so testosterone was high. And she had large ovaries on ultrasound, large polycystic ovaries on ultrasound. Now, you only need to meet 2 out of this 3 to get the diagnosis of PCOS, but this patient had all 3. And check this, she's slender. If she was obese, then we would say, okay, lose weight, and then your body will start regulating on its own. But with patients who are slender, gaining weight does not help their body ovulate on its own. So it's usually harder to treat, a little harder to reverse. Now, what's the issue with PCOS? PCOS means you're not ovulating every month. So regularly or normally in patients without PCOS, what happens in the ovaries is that you make a mature egg. It has to get to about 1.8 to 2 centimeters in the ovary. Once it's mature, gets to that size, then it releases the egg into the fallopian tube. Now, if the egg is fertilized, you get a pregnancy. If the egg is not fertilized, you get a period. So your body has to release an egg for it to know what to do. Are we having a period or is it pregnancy? In PCOS, they don't release an egg. So they grow the egg, but it doesn't get to 2 centimeters. It doesn't get to 1.8 centimeters, and it just arrests at that stage. And so the body doesn't know what to do. Most patients will do a pregnancy test and find that they're not pregnant, but they're also not seeing a period. But that egg that grew made estrogen. That estrogen is filling the uterus with blood. The next month comes again. She makes an egg that's growing, but doesn't get to the fully mature stage. Maybe it gets to 1.4 centimeters. It arrests at that stage, doesn't release. She doesn't have a period. She takes a pregnancy test. She's not pregnant. And so it becomes frustrating for patients. Like, I've taken a ton of pregnancy tests and it's negative, but I don't see my period. And so that's why we start thinking, okay, maybe there's PCOS going on. And like I said, with slender people, gaining weight is not going to help them do that. So I always ask my patients, what's your goal? Is your goal monthly periods or your goal pregnancy? Because there are 2 different things we do for that. If it's monthly periods, it's a form of birth control that we use to get you that. If it's pregnancy, it's a medication we give you to help release the egg. So we help the egg get to a mature stage so that it releases the egg, and then we time the sperm so that the sperm is around when that egg is released. So the goal determines the treatment. But that's the challenge with PCOS. For younger people with PCOS, if they're obese, I usually push weight loss to help them regulate on their own. If they're slender, like I said, it's harder, and so we usually have to help them get a period every month with some type of contraceptive.